Needs that. I had a woman come in who was about 56 years old about 3-4 years ago, and she had an estrogen patch on her. And I said, "How you feeling?" She said, "I feel terrible." She had all these symptoms. She never got in bed with her husband. Never. She was done with that. Her patch used to slip down and fall off because she was sweating so profusely. Took her off of that, put her on some bioidentical hormones, some testosterone, some bioidentical progesterone, bioidentical E2, estrogen. Called me up 4 days later and she said, "I don't get it. I feel like I'm 17 again, and guess what? I'm back in bed." Her husband drove down from up north somewhere, about an hour away, just to come in and shake my hand. And actually, if you go to my website, you will find a video on KCAL News, Channel 9, of them and their story. It's phenomenal. And when they came back, they were all cuddly again, sitting next to each other. Night switch, fatigue, who needs it? Mood swings, memory problems. Testosterone and estrogen, the number one receptors, are up here, not down here. They're up here. We got to keep this thing going. Number 2 is in the heart. So the receptors for these hormones are where they belong. And you don't have the hormones, those things go down. Your heart, how many people have heart problems as they get older? All you need is a little testosterone for that. What is the heart? It's a muscle, right? The prostate, this is very funny. Doctors think if you give testosterone, the prostate grows, right? You get prostate cancer. It's just the opposite. When people come in with high PSAs and they're afraid, give them a little testosterone, PSA goes right back to normal. Why is that? What is the prostate? It has smooth muscle. What does testosterone do? It strengthens it, heals it. Fluid retention, sleep problems, that's a huge one. Decreased libido, we talked about. Sexual performance, forget about. Involuntary loss of urine, stress incontinence. We can actually use testosterone around the genital area for females, and it strengthens those muscles, and the stress incontinence often goes away. More frequent urinary tract infections. Who needs that? So the question then is, well, what do you do about it? I'm in menopause, or I'm getting close to it, or some women go into perimenopause 15 years early, like around the age of 35. What do you do about it? It's easy. You just supplement and balance the hormones. Here's more. I had to make this list, I had to make the font smaller because, I can go on for pages and pages what menopause is about. A real big one is osteoporosis. Now, menopause is female, and it says men, but andropause is male. Same deal. The testicles stop producing testosterone. Okay? Happens to all of us. Snoring, pain, flatulence. I'm not going to say what it is, but you can ask your neighbor. Migraine, headaches, heart palpitations. So what's the difference between synthetic and bioidentical estrogen? Anybody know? Raise your hands if you know, because I'm really curious. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so maybe a small proportion of the audience knows what that means. I want you to become very familiar with this. We gave you a free copy of a booklet I have right here that's called Age Management Medicine. Get to know that book. It's got science in it. It doesn't have my point of view. It just has science. Okay? It has the reality of what is going on. Now, Wyeth Pharmaceuticals made Premarin, Prempro, okay? Medroxyprogesterone, progestins. What does that mean? It means since the Women's Health Initiative study, which came out in 2002 in July, women stopped taking hormones. Not all of them, but at least half. Poor Wyeth Pharmaceuticals. They went from selling $2 billion of this drug to $800 million. They're not very happy about bioidentical hormones because that's starting to take over the rage right now. God bless you, Suzanne Summers, because she's been a big leader for us docs in getting this thing understood and getting it to patients. So, synthetic hormones were the rage. I don't remember how many millions and millions of women around the world took them. Huge number. Women's Health Initiative study. Stroke rate increased 41%. Okay? People with taking Prempro. Double the rate of blood clots. Increase in breast cancer, 26%. Heart disease increase, 22%. Now, it wasn't the horse urine estrogen part of this that caused the problems. It was the medroxyprogesterone, which is a fake progesterone. Makes women sick. Half the women that took these synthetics couldn't tolerate them. It made them so sick. Okay? We don't have that happen with bioidentical hormones. People feel better with them. So horse urine, that's where they get the 35 types of estrogen that they give to women. Why would you take 35 types of estrogen when you have 3 in your body? What are the other ones doing to you? Who knows? Progestin. I want you to look at this tin that doesn't say progesterone. They took the word progesterone, they bastardized it, so it looked like progesterone. That looks like progesterone, doesn't it? Yeah. When I first saw it, I went, that's progesterone. When I was in training, that's what we gave everybody. We didn't know anything else existed. Synthetics. What do? Increase blood pressure. Anyone on higher blood pressure? Doesn't work too well. Anyone want to increase their triglycerides? That doesn't work too good. You want to increase your E1, which I already told you stimulates breast tissue and uterine tissue? I don't think so. Anybody need any gallstones today? Elevated liver enzymes. What does that mean? It means your liver is inflamed. Decrease human growth hormone. No one wants to decrease their human growth hormone unless they have a certain disease that overproduces it. But who wants to decrease this? This is, it's the greatest hormone in our body. It does the work of all the others. Interrupts tryptophan metabolism and serotonin. Anybody like not to sleep? Take some synthetic hormones. It'll help you not to sleep. Increase sex hormone binding globulin. That's a protein that grabs all the hormones in their body for storage. Do you want to do that? Then you don't have any free hormones to work? I don't want that. How do we do this? How do we get rid of that? Just give someone a little testosterone, that binding protein goes way down. Increases carbohydrate craving. Don't we have enough of that already? Yes. I do, from time to time. Increase weight gain. Never give estrogen without progesterone. Any women here take estrogen without progesterone? Come on, fess up. Not one. Good. The reason is because progesterone is needed to block the negative effects of estrogen. You need to have progesterone to block the negative effects of estrogen. Everything has to be done in perfect balance. All of these things are good in the right proportion. What do they say? A little salt in the stew is good, but too much ruins it. So we have to be careful to monitor these things. For anyone taking hormones who is not getting regular labs done, blood draws, is making a big mistake. Because when you add one hormone to the body, all the others are affected. You need to know what's going on. So what do we have when we have estrogen without progesterone? Proliferation of breast and uterine tissue. Increase in fibroids and cysts. Anybody like those? It causes bleeding, right? Estrogen causes increase in tissue growth. Progesterone monitors that to keep it at a normal level. Weight gain, headaches, sensitive breast, fibrocystic breast disease, bloating. Now, men need estrogen just as much as women. For what? Same things. Sexuality, bones, brain, and everything else. Decent skin. But again, like testosterone, we give a big amount for a man, a little amount for a woman. We don't have to give estrogen to a man because they already have some. But occasionally men go low with that if their testosterone is low. Now, I do use progesterone for men. Anyone ever hear about that before? Why do I do it? It's a great inhibitor of 5-alpha reductase. So if someone's getting what's called BPH or benign prostatic hypertrophy, we can give them some progesterone and bring down their dihydrotestosterone, which actually stimulates hair loss and stimulates prostates growing. So we use progesterone that way. It's also a great sleeping pill for men and women. I don't give as big a dose for men as I do for women. Shrinks fibroids, cysts, and endometriosis. Anyone have endometriosis here? It's very painful. And all it is just excess estrogen stimulation. Many countries that are not advanced like we are, The women don't get endometriosis. They're eating differently.